Okay, we're talking about infant and toddler intervention. So we look at infant and toddler intervention. um, the book starts talking about the earliest forms of communication have been termed behavioral state of communication. And this means that you have early pre-linguistic forms where you're not judging on, of course, oral output, but early uh, behaviors that indicate communication intent and social communication. So examples of early pre-linguistic forms are eye gaze, gestures, and visual attention or joint attention. So those are the things you're initially trying to assess when you're looking at pre-linguistic communication. So regarding emotional stability and early social communication, this is talking about self-regulation. So when a child gets overstimulated or gets upset, a baby specifically, can they regulate themselves and calm themselves or be calmed by others in their environment? And then social interaction. Self-regulation is an inward skill. Social interaction, which is interacting with others, it's an outward-looking skill. And both of these skills play and interact with each other whenever you're looking at pre-linguistic development. So the interactive development of the social interaction and social emotional system, this is in line with the cognitive emotional theory of that they have to have the emotional input for cognition and language to develop. And a great example of this is the video I posted on the still face experiment. Now, assessment, when you're looking at assessing emotional stability, self-regulation, and social interaction, there's mostly you're looking at mutual attention. And when you look at mutual attention, it discusses intersubjective eye gaze. That is an important mechanism for forming attachment both with infants and parents and even siblings. So you see the picture on page 241 of the infant and the adult, the infant and the sibling looking at each other and having intersubjective eye gaze. So just eyes looking at each other. And remember, with the baby books, it all says that infants start with only being able to see the distance between the mother's chest and her eye level. So even though just infants initially can't see far away, nature has designed us essentially to be able to see the distance they need to establish that intersubjective eye gaze. So when you're looking at that and looking at assessment, Figure 9.2 on page 242 talks about how to use observational strategies to ascertain whether or not the infant has intersubjective eye gaze and mutual attention. And you would do this in collaboration with the parents, would be done in isolation. And the things that you would look at would be frequency and duration of mutual engagement, frequency and duration of loss of control, which would be when the child is upset and crying. You could look at the times of day when they're doing mutual eye gaze. And then you want to consider what factors contribute to the child's homeostatic balance, which helps them be calmer and move towards mutual attention, and what factors seem to trigger loss of control or balance whenever they get very upset. Is it a wet diaper? Is it they're hungry? What are the things that seem to be upsetting them? So, and then you can develop goals to target mutual attention and increasing that time. So, again, you want to use this in collaboration with the parents with the goal that you want to identify the supports most likely to help the child achieve homeostasis, just calm behaviors, or that they can establish that eye gaze with the adults in their environment. So, an example of the goal is goal 9.1, engage in positive social interactions with caregiver support signaled by mutual eye gaze and show the ability to regain stability when upset. So how you would address this goal is that you want to improve behavioral regulation, decrease signs of disorganization. You want to increase that time when they're calm, decrease the time when they're upset and not engaging. Again, it's a collaborative effort between various members of the interdisciplinary team, including the SLP and the occupational therapist, particularly when it comes to sensory aspects of children. The occupational therapist should be involved. And you as a team member, you watch for symptoms of hypersensitivity and tactile and sensory stimuli. And so the example the book gives is exaggerated startle reflex. So they startle very easily, and all babies have a startle reflex, but those who have exaggerated reflexes, and of course, as you become more experts in the field and work with other members, you'll be able to establish what difference is between an exaggerated startle reflex versus a standard startle reflex. So what you might do is incorporate desensitization techniques where you gradually introduce the stimuli that overstimulates them little by little, whether it be noise, whether it be light, maybe even touch types of things, and introduce it little by little so the child can become more able to self-regulate and achieve that homeostasis. But clinicians need to adopt a family-centered practice, of course, with cultural sensitivity, and you want to do a form of scaffolding for parents where you frame cues to assess parents to construct coping skills rather than tell them what to think or to do. So a lot of it has to do with how you're presenting your information to parents, because you don't want to be giving them directives like, don't do this, look at your child. You want to give them more positive type reinforcers, just like we do with our children. It's very good. I noticed that she likes it whenever you look at her a little bit longer, or I like it whenever you, she likes it whenever you hold her in this position, and that seems to help her be able to calm down a little bit. And of course, you want to frame it into the language that the parents can understand. So don't make directive statements, simple comments. Frame the cues that seem most helpful and represent positive aspects of the interaction. So, but it's best for clinicians to take a supporting role to the parents being the direct roles in the infant, because this is a critical time for establishing that bonding between parent and child as well. Early communicative interactions. This would be after they are stable, after you have mutual eye gaze established. You want to shift your target to facilitating pre-linguistic communication routines by doing mutual attention through facial expressions and initiating sounds the child produces. This is very early on. This is called proto-conversations because they model conversations, but they're not real conversations. And these types of reciprocal dialogues, according to the book, at the bottom of page 243, involve initiation, orientation to the expected interaction, acceleration to a peak of excitement, deceleration, which is avoiding overstimulation, and then disengagement by turning away. So you get the child engaged, but the baby's engagement's only going to last a little bit of time, so long. So you can always tell when the baby's finished with the engagement. So in your assessment, again, you can use those communicative observational type forms to be assessing these behaviors. The book gives an example on page 244 on 9.3 for a tool for early preverbal vocalization. And because these behaviors are so early, they're really, the observation is subjective and there aren't really standardized measures like we're used to giving in children that are older. But you can use these as good guides for observing these early pre-linguistic skills. So it gives you some developmental levels. Cecile right now ends in that CV combinations with labial and alveolar sounds. Like yesterday, she was in the car, she was going ba 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 ga 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 ga, and just constantly playing with those consonants and making those noises, even though I wasn't even right there to interact with her. I was in the front of her in the car driving, but I'm also providing that interaction, responding to her as she's talking. And I think yesterday it sounded like she said, "Hey, cat," because we were playing with our cats at the house. So it's been fun to watch her progress through these different stages from just spontaneous babbling, and then now we're moving into the meaningful types of communication, which we'll talk about in a second. So for intervention, your goal would be to engage in reciprocal dialogues and show emerging initiation skills. And this would be supported by the caregiver. So you help parents imagine their child's emotional perspective, imagine what the child's thinking, and try to walk them through that. You want the parents to put the words You want them to put into words what they think their child is thinking. Like, oh, you have a dirty diaper. You want mama to change your diaper. Change the baby's diaper. And this is increasing their own theory of mind capabilities and being able to become more aware of what they're doing. And of course, these are the strategies you're going to be using in older students with more severe deficits, such as significant developmental delays, Down syndrome, autism spectrum disorders. So even though this is the behaviors we're expecting in the first 0 to 18 months, you might have to be doing this with a 2 to 3 year old, but depending on what their communication interactions are. So you want to start by imitating the child, and you can see that the desire for imitation can be observed even in newborns. And so if you know that they like to imitate, and we're born with that desire to imitate, then you start by imitating them. If they stick their tongue out, you stick their tongue out, and heightening that level of awareness of interactions. But you really need to be judging the best time and duration for exchanges. These exchanges aren't going to last long. They're going to be quick. There will be better times of day to be doing this. So you're looking for that optimal communication time. All right. Early intentional communication. This sets the stage for social and pragmatic development. This is very early on, but you want to see that attention between the adult and the child, and that child moving attention, drawing your attention into something that they desire for communication. So you have the preverbal act of commenting, which is soliciting attention to the object or self, as the picture shows on the bottom of page 246. And then requesting is directing action to object or self. So when the baby reaches out and moves their hand, and similar to want, whenever they see their sippy cup or bottle or pacifier. So when they're requesting, they expect an action. Commenting, they just want your attention to this. So again, this book has great observational forms that can be used as a clinician whenever you're in the field to informally observe these behaviors. So it is informal observations, but that are done in collaboration with the parents to see what types of acts the child is producing. Okay. Whoops. Sorry about that. All right. So again, assessment, informal observations, collaboration with parents. Less structured context works better for eliciting comments, and more structured context work better for eliciting request. So you want to design your settings to be able to get the best outcomes from your and expectations that you're desiring. Intervention. You want to focus the children's attention on the communication milieu. So the goal might be to transition from pre-intentional to intentional communication. When you're commenting, when they're requesting, they want something to happen. It's not completely linguistic. Even earlier on the top of page 247, without eye contact, requesting is not judged to be fully intentional communication act. But you want them to have eye contact, and eye contact between you, object back to you, or you want them to have eye contact between you and them them expressing to you in some way, either through a gesture or a vocalization of some interaction. It can be any kind of interaction, not just requesting something like the sippy cup. So you are looking for the book goes through several different experiments when they were looking for specific targeted behaviors. Look at the adult, look at the object, and then a discrete gesture of vocalization. But this was highly adult directed, and their parents would, they observed that when the children began to use more frequent and clear nonverbal communication acts, the parents would naturally begin to map language onto those acts. This is beginning bottom of page 247 and going into page 248 and 249. So this was known as Responsivity Education and Prelinguistic Milieu Teaching, REPMT. And the RE portion involves the clinician interacting with parents. The PMT portion of the approach is delivered by clinician interaction directly with the child. In ASHA, this is also known as the blended strategy. If you look at the ASHA research on early intervention and early social engagement. So through several different experiences, they learned that it was better when it was context-based and not necessarily so structured. When they dropped those requirements of the initial study, that it has to have all three components of the adult, look at the adult, look at the object, and the discrete gesture of vocalization. Here on the top of page 250, it talks about the experiment where the mother learned to promote her child's responsiveness by following the child's attentional lead, engaging in turn-taking such as social play routines, which would be like peekaboo, using prompts such as time delays by holding a ball until the child indicates a request for the adult to roll the ball back, and providing natural consequences such as giving the ball when requested. Now, you have to be very mindful of the child's engagement level and the point of frustration. I know even with Cecile, when she's making these commenting and requesting, particularly the requesting, for instance, drink. She always sees a drink and she'll go, da, da, and she'll point. And I'm incorporating the sign for drink as well as saying, drink, drink, you want drink, drink. But I try to wait for her to either give me some closeness to the sign. I'll do hand over hand modeling. And she might just give me the gesture that's more like want or bottle as drink. But if she does that, I give it to her immediately. And she's also now, as her repertoire is increasing phonologically, she's getting closer to the phoneme. So now da for drink sounds like ding, ding, ding. So I give it to her when she moves from da to ding. But I can tell when she is about to reach a point of frustration, when she starts whining and squealing a little bit, going, ah! And at that point, you have to give it to them so they don't reach this level of frustration. So you have to monitor the level of engagement and be sure not to get too far into frustration levels with children. So studies have found that prompting is a big a component of this, and that helps the parents become better scaffolders and helps the children increase their communication ability early. So with the REPMT, the results have differed based on mother's education and pre-treatment interaction style. Of course, sometimes the higher education, the better responsiveness, but where the highly educated benefited from the PMT techniques, and children of less well-educated mothers were less responsive at the beginning of the study, but they benefited more from the RE responsivity education. So much of this is parent training and the level of parent knowledge, so you have to take that into consideration. They've also found that REPMT intervention works best with children who have lower skills initially. That seems to be, you have more growth whenever they start at a lower level. And some other studies have found, this was at the bottom of page 250, about paragraph, the parents were taught to recognize real or possible communicative attempts and to respond to them in meaningful ways, so context-based, and that seemed to have good results as well. So at the top of page 251, this summarizes all of these studies to say that when parents learn to modify their responsiveness to their toddler's messages and treat them as intentional communicative acts, the child is likely to benefit, and these have more naturalistic responses. So essentially, communication is in the eyes of the receiver. When Cecile says da, and I interpret that as drink, whether she says da, and I interpret it as that, or even by, depending on the context of what she's using it, it's all in the eyes of the receiver for intentionality and responsiveness. So the more that you respond as a meaningful communication act, whether the child means it or not, the child's going to map that linguistic skill and say, oh, when I say that, mom responds in this way, and this is the end result. We're establishing communication. So it's very important to emphasize to parents, treat everything as a communication act that can be interpreted as meaningful and responsive to the infant. Okay. So joint action routines. This is standard routines that you might be doing together as a family, such as, or not as a family, but as the adult and the child or the infant interact, such as peekaboo. It has reciprocal imitation. As children gain in confidence during these pre-linguistic turn-taking abilities, parents begin to introduce variations, routines, and use time delays to provide opportunities for children to interact and provide and give feedback. So during this stage, children move from intersubjective or mutual attention to shared attention, or joint attention, focused on other people, animals, and things in the environment. And this is such a critical skill early on. We know this is a sign of autism spectrum disorders when they can't establish joint attention. Okay, so these would, again, those proto-conversations, those early conversations that mimic real conversations. And for assessment of joint attention, again, you're going to use observational data. Figure 9.8 gives you an example of some types of behaviors you can observe, such as follow parents' line of regard, respond to parents' use of object, responding to parent routines. So parents are engaging their children in familiar routines every day, such as mealtime, bath time, and play. And so peekaboo is a good example of a good routine to establish this joint reference and joint attention. We were playing peekaboo yesterday in my house. It's a fun game when they're little because I just get so much joy, and it's so fun. It establishes that object permanence concept, cause and effect. So much can be observed just from playing peekaboo. So your goal might be the child will engage in interactive routines such as peekaboo, patty cake with a caregiver. So parents use joint attention and referencing to scaffold the child's attention to features and patterns and shared experiences. Like you're playing peekaboo and you want the child to respond to that. You want to follow the child's line of regard and commenting. So this is very much child-led and context-based, much like everything else. The family-centered intervention process for this goal should begin by helping parents follow the child's line of regard and comment on the objects of the child's attention. So you want to draw the parent's attention to that the baby's leading this, the infant, the child, not them as the parent to draw their attention. So a nursery games or good joint action reference routines that you can use. Peekaboo, reading, joint share book reading, which we'll talk about in a little while. And I found I didn't even recognize some of these games. The book mentions like Creep Mousey, but any types of those early games that we play with children, patty cake, peekaboo, if you're happy and you know it, or good nursery rhymes, bath time, wash the hands, where's the tummy, there it is, where's the belly button, there it is, feeding. So any of the daily routines that you engage in with children. Right. Early play. These jars and individual play with objects evolve into a higher level play. And we're definitely at that level with Cecile. She'll pick up a play toy phone and put it to her ear and go, hey. She likes to engage in that. So, or pick up something to try to brush the hair, even though we don't have any hair. So the different types of symbolic play, we have symbolization, which is using one object to represent another, such as a block to represent a vehicle or a marker pen to represent a microphone. Decontextualization, which is using actions in a playful manner separated from typical settings, such as pretending to eat when it's not snack time. And decentration, using actions in play that are unable or not allowed to perform in real life, such as cooking, caring for babies, shopping. I had a great picture last night of Kennedy and Cecile at Kennedy's table. And Cecile is sitting in Kennedy's in the chair at the table. This is a school table, essentially, and she picked up a pen that had note at the top on it and was trying to put it on the paper to try to write in imitation of what Kennedy was doing. And then she picked up a paintbrush because she doesn't know the difference between a brush and a pen. They're both the same, and was trying to do the same thing with the brush, trying to attempt to write and get a response from that. So in this, you want to stretch their ZPD. You want to stretch how their learning levels. Again, observational tool, page 254, 9.10, and you can see this goes into higher linguistic forms and higher age levels, even to 19 months. So the things that we might, illocutionary acts such as true intentions by the end of the period, that's in 5 to 12 months, 10 to 18 months. Language, they show intentional commenting and requesting. And then symbolic play, you have directing, requesting, commanding, interacting. And you can see by the end they've moved into true verbal communication. So look how much a baby grows from 10 to 18, 19 months. There's tremendous language growth at this time. And assessment, exploratory play, it begins around 2 to 4 months, extends to around 10 months. They assimilate objects into current sensory motor schemas. So they're just feeling around with things and manipulating objects by grasping, holding, maybe mouthing them, big mouthing. Exploratory phase overlaps with the phase of object manipulation play. And it's experimental manipulation of objects in non-functional ways, such as stacking, inserting one in another, and lining them up. That's one of Cecile's favorite toys, is just those stacking cups. She always likes to get them and pull them apart and then put them back together. Functional play, which begins around 10 to 12 months, is you pretend to use objects with their typical functions, such as holding a phone to the ear. And then symbolic play emerges around 16 to 18 months when children use one object to symbolize another and begin to perform play actions on dolls rather than themselves. So these are all the types of behaviors you're observing with the parents. And I found this is interesting in the middle of page 255. We know that play is critical for early language development, but it's unclear on if children with a language impairment show impairments in early play or not. So some research shows that they do have delay play and some does not. So it's really unclear if these develop separately or together. But when we are assessing them, we want to assess both verbal and nonverbal symbolic functioning to see if there's any indication of delays in overall language ability, in addition to your standard language development that happens in these play periods. For your intervention, you want them to transition from maybe pre-symbolic play to symbolic play, and you can do this by doing repetitive play routines with adult modeling of play. So the adult engages in a play routine and what they're expecting the child to do. Again, all of these targeted behaviors and interventions are best in the context of family-centered. Parents, clinicians, and preschool teachers can provide the context that can support children in early intentions and symbolic functions by building playful routines. So everything is play-based, and even with your older students who are developmentally at this level, you have to have those play-based routines in order to establish these pre-linguistic communication skills and move them to a higher linguistic level. So now that we've established early pre-linguistic interactions, now that we've established early play, we can move into early words with infants and toddlers. So first they have vocables or proto-words that appear before real words. This would be examples of that vocal babbling like I was using earlier. Da, 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 da. Of course, the first words appear around 10 to 12 months, but it's not uncommon for the first word period to extend to 18 months. And true words are recognizable as when they're used consistently and used for the same concept in more than one context. One of Cecile's true words is hey, because she says hey consistently, even to strangers. She was in the hospital. Anytime anybody walked in, she'd go, hey! And then uh-oh is another one of her true words. She's been saying mama for a long time, but I think the intentionality is just now being established because she'll look at me and go, mama. And before it was just random and she wouldn't be able to repeat it. But now she can say it again. Say it again, mama, mama, mama. And when Daddy was coming home the other night, she's been saying dada a long time. And when she saw him at the door, she went, Daddy! So we were establishing more and more real words. Cat or kitty is another one of her real words that she uses consistently in more than one context. But you'll hear the real words before you'll hear true words before they're actually established as real words that are meaningful. So a lot of babies engage initially in jargon that form a variated babbling, like I was saying, da ba 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 ba, ga 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 ga. Cecile's actually in here with me. I'll see if she talks. Can you say ba 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 ba? You can ba 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 ba. I'm getting all kinds of joint referencing and mutual attention, so we'll see if she engages in a minute. And then as the vocabulary develops, you get more words, and there's this tremendous vocabulary spread between 1 and 2 years age. Like I was saying, that difference between 10 and 18, 19 months is huge. They notice new words, perceive their sound structures, understand their meanings, articulate them well enough to be understood, and store them in personal lexicons for literal retrieval in appropriate and novel context. That's all happening when children are learning words, all happening in this first year. So it's just amazing how quickly language can develop. And then, so to assess early words, it gives you a observational tool for early words, Figure 911. And you want to, when you're doing assessment, you want to identify their rate of learning for true words. And you want to see how long it takes them to establish that word as a real word. The body of research that the book references in the middle of page 257 states that typically developing children at approximately 5 word roots per day from 18 months to 6 years. At 6 years old, they can comprehend approximately 14,000 words. And of course, the difference between comprehension and expression is huge. I was just telling Cecile, "Where's your passy? Get it. Where's your bottle? Get it." And she can do that. She's not saying pa or passy or not bottle. Let's call it. It's milk. She's drinking milk from a sippy cup. So she's not necessarily saying those consistently. She's signing milk sometimes, but actually understanding those words is there. You can use formal and informal assessments. So some of the formal assessments, the book list, or the Language Development Survey and the MacArthur-Bates Communicative Developmental Inventory. So this is the first time that there really is some formal assessment established that you can use. That's beyond observation, but and because you're actually looking for the responses the child, not responses, but the words the child is producing. However, a lot of it, most of it, is still very observational and should be done as a team with the parents, in collaboration with the parents. For your intervention, you might target the first words and single word utterances representing varied communicated context used for multiple functions. So this again involves consulting with families about how to elaborate familiar routines and to map them onto an appropriate set of words that fit children's interest. So you want words to be referential and expressive. Referencing something and then they want to express it. You want to embed the activities in targeting other goal areas. For instance, it might be play, it might be narration, it might be book sharing, but it ensures a richer context and a better prognosis for intervention. So the book calls this focused stimulation approaches, in which you focus, you have a narrow focused attempt at language development. And this can be done with parents or clinicians. And you really want it to be context-based and focusing on improving those child's utterances, not necessarily having to repeat it, but constantly monitoring and mapping words onto the routines. So you're basically, language is happening all the time and you are bombarding them all the time with words and vocabulary. Hang on. All right, 2-word utterances. This begins between 1 and 2, and it's a transition from hollow phrases, which would be maybe they might seem like they're 2 words when they're not. It's just a phrase that they're used to repeating, and they're 1-word utterances that function like a sentence, and you're moving that to 1 to 2-word utterances. Some hollow phrases might be. Well, like for instance, whenever Cecile's saying "hey" all the time, frequently, uh-oh is a multisyllable. It's 1 word, but it's multisyllable. So you're moving them from language content to language form. Whenever you're trying to grow this, and you want them to be processing the semantic grammatic rules rather than just the content form. So this is when the agent, action, object types of linguistic behaviors come into development. So pairing two different types of forms of language, a noun and a verb, an action and an object. The assessment, it includes verbal and nonverbal evidence. We must have, because the nonverbal you have to use because sometimes they can be difficult to understand. So you need to use everything you know about language development and phonological development to ascertain what the child's intending to say. It should be done in, intervention. You want an intervention, you want to target with vocabulary and play with and word intelligibility. Again, you do this in play context. So very naturalistic, expanding on what the child's doing. If the child says milk, and you can say, yes, want milk, you want milk. And, or the child might be saying cat, and we'll say, oh, kitty cat, bad cat. We always call our cats bad cats because it's just funny. And so, or soft kitty, mommy go, Kennedy go, sissy go, where's sissy, things like that, and expanding on what the children are saying on those one words to bring it to 2 to 3 words. You want the parents to be partners in communication with you to develop this and train the parents on how to build this in their environment. So the focus, stimulation, and conversational recast seem to be very the best types of intervention techniques. Hey, sorry, baby's distracting me. You can look at milieu language intervention, which incorporates structure and scaffolding. So you structure the environment. Maybe it's a play-based setting where you have specific toys and specific objects to be playing with and things that the child's interested in. And then you use that to, it's child-centered, and you use that to expand on what they're doing and increase that ZPD. So focus stimulation, you expose a child with language delay disorder to multiple exemplars of 2-word utterances within meaningful linguistic contexts, but without requests for imitation. So it doesn't necessarily benefit children whenever you require them to repeat something after you. It's better if it's contextually based and you're just expanding on what they're saying. So, what happened? Uh-oh. Now, whereas conversational recast methods have been shown to outperform requests for imitation and efficiency. Uh-oh. So you hear our early language development right here. Uh-oh, drop the passy. And so if we know that having them repeat isn't as effective as recasting it, they say uh-oh, and I'm saying uh-oh. We drop the passy. I'm expanding on what she's saying. Hey, got it. Now, you do want to set very specific and deliberate goals in the naturalistic language intervention context as much as possible, with deliberate goal setting and careful monitoring for signs of change. This is at the bottom of page 263. But everything needs to be naturalistic and very child-centered and expanding on what they're saying. Recasting it is expanding on what they're saying, not requesting imitation and requiring imitation, because you're not always going to get that, particularly for children with more significant intellectual disabilities and on the autism spectrum. So you want to focus on joint attention, communication functions, and use the daily routines of the children to increase that language development. So finally, the book discusses the early literacy component, beginning with early narration. So literate language exposes children to more varied vocabulary and discourse structure. We know there's more vocabulary in books than we have in everyday conversation. In addition, the discourse structure is different in narrations and stories and books than it is in our conversation. So it exposes the child to more various structures. Now, narratives for children begin around 20 to 24 months. They'll begin to start telling you stories about what's happening in their routines. It's one of the best predictors of school success, though. We know that inability to produce effective narratives is a huge indicator of a language impairment. We also know that children from low SES backgrounds might not be getting the narrative exposure that other children are getting. So we need to be mindful of what they're exposed to and their knowledge of narratives. So in assessment, we want the assessment to occur in naturalistic context, and we want to be assessing their verbal and nonverbal communication forms, including gestural reference to objects and events to relay narrative information. An intervention might be to target co-constructions of stories of unusual events, because usually that's how narration starts, is the child starts telling a story about something unusual or strange that has happened to them because it's so significant in their lives, they remember it so much. Then emergent literacy, children's use and understanding of literacy precede reading and writing abilities. There's a reciprocal dynamic relationship between oral and written language. And we know that this is also a predictor of later academic achievement whenever they have early exposure to literacy. So it's very critical that as you're training parents with children with communication deficits in early childhood, and infants and toddlers, that you're incorporating the literacy component and telling them to read books to their children, because often they're not, several of you have said in some of your discussions, parents aren't reading to their children anymore, and that's completely accurate. So it's our jobs as clinicians to train parents in how to do, and how to read their children and how to incorporate that in their everyday routines. For your assessment, you want to have a word level awareness assessment, such as words, objects, logographic symbols such as McDonald's arches. Walmart would be another good one in our area, recognizing that sign for that name of that store. They don't necessarily read the word, but they can recognize that symbol. And then you want to have a lot of social interaction around books, such as the sentence and discourse level, and you can use this to assess their early skills. And this can be observation of interest and attention children show when adults try to gauge them in interaction with books. Do they pay attention to what the adult's saying? Do they push the book away and not attend to it at all? And if they don't attend to it, how do we increase that attention ability in them? So intervention, you want to do sound and wordplay and naturalistic play-based context, such as, again, nursery rhymes. And it's an early literacy skill, nursery rhymes are a way to target those early literacy skills of rhyming, because you're establishing those patterns of words and how to manipulate words. You also can have shared and interactive book reading with scaffolding, where the parents are reading the books and talking about them, even if it's just one of those simple books like the touch and play books. Cecile loves that, with the soft bear and the soft cloth and the fuzzy kitten. She loves touching those and thinks those are just so funny. And you can tell she's trying to establish the difference between that picture of a cat who looks like our cat and the fuzziness on that, and then the real life cats. She touches it and she sees it and she's almost expects it to be the same thing, but realizes it's different. So it's also exposing them to different types of pictures and picture knowledge, and real pictures versus black and white pictures and symbolizations. So you want to expose them to as much as possible regarding that literacy, and that's going to increase their overall communication abilities. Always, again, in the natural environment, and a lot of parent focus, training parents on how to implement these strategies every day.